Today we are dealing with occupational health and safety, fifth module. Uh, it is occupational health and safety consideration. The outcome of this session is this module is students can understand the important terms in occupational health and safety consideration, handling of chemical safety measures in wastewater, in chemical industries, and safety in construction site, and responsibility of workers in occupational health and safety. Okay. Workers in wastewater treatment sectors are responsible for day-to-day operation, maintenance, troubleshooting and handling of special problems of municipality, industrial and other wastewater treatment plants. Occupational occupations can include level 1, that is wastewater WWR, that is wastewater resources plant operations. Level 2, that WWR plant operation, senior operator, water resources specialist, maintenance operator, etc. in both municipality and private facilities. Certification is a set of applied science technology and techniques of standards. Okay, so this is uh, an introduction, that is for a wastewater treatment sectors. It is responsible for day-to-day operation maintenance, and they are handling it. They are handling different special problems, either in a municipality or industrials or wastewater treatment plants. And this have two levels. That is, first one is plant operator, and that is wastewater operator and wastewater plant operators. And so, and this is a set of applied science technologies techniques. Injury statistics. There is a lack of there is a lack of basic statistics for injury and exposure in this sector. Worker safety does not have satisfied statistics specification to this field, nor to many other judiciaries. Within North America, in United States, the sector contains both recycling and wastewater management. Therefore, the injury and facility rates are combined. There is a little information about long-term effect of exposure to chemical and pathogens. There are there is a conflict evidence regarding the development of cancer, although pancreatic cancer appears to be higher in this sector. Generally, there is a much higher rate of injury generally than other occupations. So, since there is a lack of uh, um, this means this for any um, for any management of they need a statistics. So this wastewater means operation persons, there's a very less statistics available. So especially in this field, um, in within this any means this, it is very clearly told that there is no specific statistics in this. So, and the chances of injury in this field is much higher compared to the other. And there is a information that they are exposed to the chemical and pathogens. Then there is a even conflict that there are regarding the development of cancer, especially the pancreatic cancers, which is in the higher sector. Uh, and it is very clear that in this field, uh, major or minor injuries are higher compared to other occupations. This is a study done by Spellman in 2013. So, who are affected? This sector includes workers involved in severe, severe inspection, maintenance work, and sewage treatment plants operation, Most workers are male between 35 to 55 years of age. So most of the workers who are of age in a gap between 35 to 55 years are highly affected, and they who work mainly in especially in the sewage inspection, maintenance, and sewage treatment plant operations. What are the hazards? Workers in these sectors are exposed to varieties of hazardous chemicals and biological materials containing within the influents and reagents used in the water processing or generated during the water treatment. Means it is very clearly that this in this type of work, the workers are directly exposed to the hazardous chemical and biological materials, which are effluents and reagents, uh, and especially the effluents and reagents used in the water processing uh, during the treatment, water treatment. So first one is the biological. What is biological hazard? So there is a high potential of illness arising from contact with virus, bacteria, and microorganism in sewage. The most serious viral risk is hepatitis. The most serious bacteria risk is tetanus. The main routes of exposure are hand to mouth contact. Okay, biologically, how biological hazards occur, especially when in the sewage, which contains a virus, bacteria, and microorganisms, and especially this affects the hepatitis and the bacteria in which it contains. Since the sewage contains tetanus, its the risk is the bacteria of tetanus, and this is caused due to the hand to mouth contact. And since this whenever the during the work, if their hand to mouth contact occurs, this biological bacteria enters the body. So what are the chemical uh, agents? So confidence space containing sewage can sometimes be deficient in oxygen due to the organic oxidation and displacement of carbon dioxide. They can also contain flammable gases such as methane and toxic gases such as carbon monoxide and hydrogen sulfide. If the sewage water, if it is collected for more than usually you know that you have a general idea that if the sewage water is collected for more than 1 or 2 days, it start degrading, and due to during this process of degrading, it uh, produces more chemicals like chemical gases like uh, which are toxin like methane, and during this carbon monoxide and flammable gases like methane and other toxic gases. And due to this production of this type of gases, the content of oxygen is will be less, and carbon dioxide will be more. Carbon dioxide, carbon monoxide, and hydrogen sulfide will be more. So when during the treatment of this type of sewages, the sewage whoever is treating this type of problems will be in a chemically in contact with uh, this chemical. This they are come to the chemical hazards. So during the process of treatment of this type of sewage, they will come into chemical hazards. And what are the metals hazards? As per the study done by Brown, metals are generally not air stripped into the air is sufficient quantity to be significant with expectation of mercury. Therefore, they accumulate either in sludge or pass into the receiving water. Other possible hazards include obstacles and radioactive materials from medical facilities. So, whenever uh, quantities see sufficient whenever there is generally when you have materials which are get either accumulated through the sludge and which pass through the water. So these are the metal hazards, and this get accumulated in the sewage, and this causes hazards while treatment during the treatment. And other is radioactive materials from medical facilities. So if any radioactive materials are used, so this type of metals also will be hazardous for the sewage treaters. So these are the so there are two primary routes of pathogen and chemical contacts are first one is inhalation. See, the inhalation means it's nothing but the breathing or through the nose, whatever it's in which this through the nose, whatever enters the body is called inhalation. So let's study this. This is the most common routes of chemicals and pathogens to enter the body, usually via air stripping from wastewater, bubble aeration, workers working near weirs, outfalls, and aerated tanks, dewatering processes and drying, compacting compacting and incineration, exposure to the chemicals while removing debris from the treatment plant equipment. So inhalation, how it is means first one is if it is if the worker working in aeration tank, bubble aeration, so continuously during the aeration is nothing but the process of introducing the oxygen or air, so through which the chemicals are removed from it. Is a type of a treatment as you all know it. So during this, whenever there is aerated, so the toxins are exposed or liberated to the atmosphere. Whoever is working nearby in this place, through inhalation, it enters his. And worker working near it, aeration tanks, other types of aeration tanks, and dewatering processes during in the area of dewatering processes or a drying processes. In this area, if the worker is moving around through inhalations, this chemicals are this chemicals come in contact with the body. So and even in chemical while removing the chemical debris also, the chemicals in the air are inhaled. So through inhalation, this affects the body. And skin contact. This is a route of entry for both chemicals and pathogens. Pathogens. So this includes being splashed in the mouth or on the skin. See, if while removing the debris, if something, if means like if you go, if someone else working adjacent, if water splashes, if it touches our skin and our mouth or our other parts of the skin. So this is one route of skin contact, and chemicals can be absorbed through the skin from contact with wastewater or sludge, and even through this, the skin will absorb the chemicals. Diseases, disease organism can enter body through cuts if we have any wounds, and if the wastewater is splashed through the on this wound, or so this disease organism can enter through this cut. Abrasions and needle sticks if the needle is sticks, and when removing screening from a bar screen, or means if any cuts or through any needle is plucked while cleaning process, or any cuts of a bar or while screening the sludges, if it happens, so through this type of contact on the skin body, the bacteria and the chemicals, pathogens and chemicals enter uh, the body. So through this skin contacts, this type of hazard will happen in the wastewater treatment. Worker education. So through inhalation and through direct skin contacts, we know that the hazards will enter. So it needs a proper education. So workers are to be educated. So education about a personal hygiene and safety work practice is extremely important to minimize the contact with sewage to prevent illness. While employer bears the primary responsibility, everyone in the workplace needs to exercise caution. It is very clear that we know that through skin and through inhalation the hazards will enter, means the chemicals and other uh, pathogens will enter the body. So for this they should be educated with the personal hygiene, safety precautions to be taken while removing the sludge, so that any wounds and cuts, so this is extremely important, so that they can prevent the illness. And while it's a primary they need to exercise some of the important cautions, like examples of workers including the following: avoiding direct contact with the sludge, avoid aerosoling aerosoling aerosolization sewage water, or minimize exposure time in the area where aerolization is occurring. Make sure ventilation systems are functioning properly when working around the areas where sewage may be aerosolized. Throughout, throughout cleanliness all exposed injuries with thoroughly cleans all exposed injuries with soap and water and keep them covered with a bandage, specifically preferably waterproof, while at work. Seek medication attention immediately after suffering cuts and penetrating injuries. So they have to exercise some of the previous necessary cautions, like avoiding direct contact with the sewage. Means aerolization means where the chemical reactions or aeration is happening in the sewage. So we should the means since it is aerating, so it will be producing a lot of chemical into the air. So doing that, yes, surrounding either it has to be they should see that either they should be less exposed to this type of atmosphere. If they are there, they should be in a very less time, so that they should finish up their work in that space and move out as early as possible. And they should see that if they have any cuts or wounds, it should be cleaned properly with water and soap, and it should be clearly bandaged with a waterproof bandage, so that during the working in the wastewater or sludges while working in this area, so that this doesn't enter through those cuts. And they should take a previous medications immediately if they are suffering from any uh, penetrating injuries. If they have after suffering cuts or penetrating, if they should seek the medical attention. And if the worker is suffering from a skin problem, they should seek a physician before working with the sewage. Avoid touching the face, mouth, hand, eyes, or nose with dirty hands or other items, and avoid nail biting. Thoroughly wash the hands and face with soap and water before eating, drinking, or smoking. Eat or smoke in designated areas away from the sewage contamination. These areas must be kept free from contamination by leaving any protective clothing and boots in a separate area, for example. So, some of the other questions are: if the worker is suffering from any skin diseases, then he should uh, go to a physician or doctor before working with this type of sewage, and they should practice of not touching their face through hands or eyes with the dirty hands, or they should not have a habit of nail biting habit also, and their hands should be clearly covered, and they should wash thoroughly their hands and face with soap before. eating or drinking or smoking. So once the work is done, when they are out, they should thoroughly wash their hands and everything, other parts of the bodies which are exposed thoroughly, and then they should go for either drinking, eating, or smoking. Eating or smoking in this designated area is always it's prohibited. It's and it's prohibited, and they should not doing eating or smoking because it is a directly exposure through the air contamination, so can enter the body. So surrounding in this surrounding areas, there should be no drinking or eating or smoking, and they must be keep they should be leave their protective wears like clothes and boots separately in the other areas which are contaminated, which they are used in the cleaning process. Once they enter their houses or any offices, they should keep it separately so that it is not spreading the disease to others. Use appropriate protective clothing at work, covers all, and personal protective equipments like boots, gloves, plastics, face shields, and where and where required wearing respiratory protective equipment. Remove personal protective clothing and footwear at the end of the shift and leave it at home. Shower and change out of work clothes before leaving work. Report damaged equipment. Report all work related symptoms to the employer and the physician. So it's the wastewater, in the treatment of the wastewater, they should have a habit of using uh, full clothes, protective clothes, which covers the entire bodies, and boots, especially gloves for the hands, plastic face shields, so that any direct face contact splashing on the faces will not happen. And and if necessary, if in any, they should use the respiratory protective equipment also. And remove, and the thing is that first the personal protective clothes and footwear are to be removed at the end of the shift. This protective, whatever the clothes or equipments, whatever, at the end of the shift of the completion of the work, they should be removed at their um, leave at the workplace only. At the end of and leave it at the workplace only, and then they should take a shower and then uh, go for the home, or leave the work. And if any, while working, if there is any damaged in the equipment, they should report it so that it should not hurt the next whoever is in the next shift, or not. It's not a good practice to use this damaged equipment for the next day also. So they should report to their seniors or seniors, and if they are work related any symptoms, they should work related symptoms of health, then they should report it to the employer who is hiring them and the physicians very clearly. And it's a prime duty of, and is a prime concern, one important concern, that the work related symptoms to the employer and the physician. And this may include what are they should report it, like cramping, cramping stomach pains, diarrhea, vomiting, yellowing of skin, symptoms of breathlessness, chest tightening, and wheezing, redness and pain of eyes, skin rash and skin rashes or pain. So these are the basic which they have to uh, uh, report it to the higher authority, like crampage of stomach, that if they're having diarrhea or vomiting, or any yellowish of the skins, and if they're getting during the work, if they're getting any symptoms of breathlessness or chest tightness or wheezing, So, and if anything related to eyes like redness and pains of eyes. So, and in the skins, if there are any rashes or pain. So, all these things they have to report to their employer and the physicians. And test for the diseases exposure can be, what are the tests for the this diseases? Skin test for turbulence and fungal infection, liver function test for hepatitis, white blood cells leukocytes counts, urinals for fibrogen degradation production, concentration. Workers with these symptoms should see the physician. Make sure that the physician is aware of the condition of the work and the potential exposure. So these are the basic tests that which are regarding the skin for the if they are having any fungal infections, and liver functioning if they are having hepatitis, function of being of the liver, and especially the counts of the white blood cells, and the urination or urinals for fibrin degradation processes, concentration. All this has to be seen. They should concern the physicians or the doctors uh, to make to make sure that the potential conditions of the exposure. Okay, so these are uh, the basic informations of the water treatment of health safety consideration for the wastewater workers in the wastewater. We'll be continuing this in the next session also. Okay, thank you. Thank you for attending this first session of module 5.